went from the bonnet, found face down on the floor.
2, 3.
Paediatric trauma
It's
call.
a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
Kings A&E, how may I help?
Kings College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
About 3.5 hours. Oh, bloody hell.
I'm going to take you over to this bed now.
Freezing.
Fine. Do you smoke at all? Do you drink any alcohol?
Yes, I do.
What do you drink?
I like a glass of wine with my dinner.
That's okay, a glass of wine a day.
It's
Supposed to keep the doctor away, apparently.
I think I'm just about to faint. Really? You need more coffee. Or less coffee. No, one or the other. It's either more coffee or less coffee, or more alcohol or less alcohol. It's one or the other. I think the reason that we do so much self-medicating is probably with the pressures of life. I think people just need something else. They need a crutch. Unfortunately, about 60–70% of what I see every day is as a result of alcohol and smoking. They're probably the commonest ways that we would see people self-medicate.
Right, take care then, Pat.
Yeah, I will.
Thanks a lot, mate.
Wasted your time, you
I have not wasted my time.
Right.
No, you're having too many falls. You was out conscious.
We could go round the doctors anyway.
No, you will not till next week.
Here, sit down. Get a chair.
71-year-old Pat has a history of brain hemorrhages. Tonight, she was found unconscious at home by her husband, Bill. It's her second collapse in the past week.
Georgie, can you send that round? Yeah, get her booked in.
You're all right.
I'm fine, thanks. Hi, Pat. My name is George. I'm one of the...
New, another one.
I'm one of the staff nurse here. I just come to check your blood pressure and all.
The blood pressure's all right.
Do you?
Let them check it.
Have you, is this from today, this cut in your...
Yeah, I fell over last week.
Last week? Oh.
Otherwise, I'm fit as a fiddle.
Okay. I just wanted to take your dressing gown off, if you don't mind.
Oh, you bleating wait. I need this dressing gown on. It's so cold in here.
All right, love.
Oh, it is cold.
Have you had any alcohol today?
Any what?
Alcohol.
Yeah, I've had me drinks and I always do.
Something nice?
Oh, gin and tonic. I love them. He likes his old whiskey, don't you, Bill? That's his nightcap.
All right. Good.
And me ticker, all right?
It's fine.
Yeah, see, I told you, didn't I?
You are the next one to be seen by doctors anyway.
Ain't he coming yet? Because I want to bleat and
Have
go
a little
home.
sleep for her. You wait.
What?
Don't be impatient. Behave yourself.
I ain't done nothing yet.
Just in case you do. Just in case you do. Don't get stroppy with the doctor and all.
Kings A&E, how may I help? Severe posterior head. In bleeding from what? Right ear. Yep. Yep. 7 cheers. 7 minutes.
Adult trauma call, 7 minutes.
Paramedics are bringing in a 63-year-old man. He was found lying in the street by a neighbour.
Boggy mess, head injury, query cause with right ear bleeding and vomiting.
Blood coming from the ears usually suggests that somebody's got a fracture of their skull.
Yeah, I know. I've left my black pen in the... Male, found in street, severe head injury.
It's one of the signs that somebody with a head injury has had a significant head injury.
It could be wrong. What is it? Delta. Oh. Yep, we're going into 2.
Why don't we keep him on the scoop? Let's have him flat.
Right, okay. 1, 2, 3, go. This Mick was found laying flat on his back on the pavement. He's got blood coming out of his right ear, pulse of 73. He's really, really combative. As you can see, we've had to take the mask and everything down. And...
No moving, darling.
Mick, I know you've had a drink. Can you tell me what day of the week it is? Keep your head still.
Thursday.
Sorry?
No, it's Friday, isn't it?
OK, and what month is it?
March.
And what year?
Treating patients who are inebriated is very difficult, but you have to assume for their safety that it is not the alcohol that's making them behave the way they are, that it's something else.
So 2012.
OK, and do you drink every day?
No, I don't.
No? Is it just a bit of a bender tonight?
No, because I'm Irish and it's Paddy's week.
Oh, it's Paddy's week, not just Paddy's day.
I love that. St. Paddy's week.
OK, now, have you got any pain anywhere?
So I just need to go and see my wife.
Your wife's coming. She'll be here in a minute.
Of course.
No, stay still.
Keep nice and still, don't move your head, because we don't know if you've injured your neck. We're going to have to scan his head.
They are the one group of patients that are very likely to catch you out, because when people are drunk, it all interferes with the decision-making process.
Keep still, Mick. We've got you.
Mick.
You need to talk to us, but just keep still.
You promised you were going to be a good boy.
Otherwise, we're going to have to put you to sleep.
That's all right, darling.
Mick will need a CT scan to determine the extent of his injuries, a procedure that requires the patient to remain completely still.
Right, let's go and get it done. You're just going to have to hold him. Hold his head.
What we worry about is that they may also have a neck injury or a spinal injury, and if you've got somebody who's thrashing around, they may actually cause themselves to have a further injury.
Yeah.
They could end up paralysed.
No, I think we're going to have to just put him to sleep. We've got our drugs.
Hello? Hello?
You hungry, fam?
Pizza Hut.
What, delivery to the hospital?
What would you like?
Medium meat feast, barbecue.
I'll just have a slice of his and a slice of yours.
I'm still in A&E. I think I broke my finger. Yeah.
Hey, please, can I get delivery, please? The postcode? Ooh, that's a great question. You might have to give me 1 second.
They trapped my finger in the door at the bank. Yeah, I mean, but look at your finger.
You want me to come for collection, dude? It's like 5 minutes up the road. You don't deliver to my house in Brixton. Like, please?
Right, OK, team. Are you happy to hold head from that side?
It's been 20 minutes since Mick was brought in with a head injury. Although he's been drinking, doctors are concerned that his confusion is a result of a brain hemorrhage. He's being sedated to prevent him from injuring his neck.
Right, mate. We've got your head because we're going to need to get you off to sleep. Your wife's here.
Let's get some proper tape.
Where?
There, look, here you go. Say hello. Don't try and lift your head. Come and just look over him so he doesn't believe me that you're here. Can you look over? Just look.
Well,
I'm here.
We're going to turn it off in a second anyway.
Oh, yeah.
So there's drugs already.
I'm here, don't worry.
okay, thank you, darling.
What size tube do you want?
We've been married for 36 years this year. When we were younger, he was quite the Jack the Lad. He really was. He liked to play darts and snooker, and he was really a man's man.
Tish, you're here.
I'm here, don't worry.
We need to scan his head to work out how much of this is booze and how much of this is head injury. And you won't keep still for the scan.
I never bashed my head.
So we just need to send him to sleep. Do you know if he's got any medical problems?
He's on antidepressants.
OK, he's never had a problem with anaesthetics before, though. OK, have you got his head there?
He's a good-looking guy. He had the big bell bottoms and the big platform shoes. He says he looked like Georgie Best.
Found it.
It won't take long. We'll just
Right, let's go and get it done. So when you're ready, I'll get the collar off.
We got married at Wandsworth Registry Office. And after the ceremony, we all walked down Wandsworth High Street, me in my wedding dress, to go to the Spotted Dog pub down Wandsworth Road. And as I walked across the traffic lights, all these drivers were honking their horns and waving at me.
Right, Mick, sweet dreams. Fantastic. OK. Should we put the collar back on? Because although he won't move, per se, we might move him.
He was kind. And he was generous. And he'd give you anything. If he could, he would give you anything.
Majors.
I thought you was dead.
You are?
I thought you was fucking dead. You look on a deck we had. You look, watch me. Hello. You was like that.
What?
On the floor.
Yeah, all right.
And I was trying to get you out, and there's no response. That's why I phoned the ambulance. You had too many bloody fools to my liking. You better pack that drinking up.
You what?
Better pack that drinking up, I'm afraid. It's affecting you. 17 years old when I met Pat. Pat was a bit of a tearaway. I have to say, bit of a tomboy.
Is it Mrs. Cathersides?
Yeah.
Hello there. My name's
Go out,
James.
Doctor.
It's up to your... Is this your
go
husband?
No.
He wants to examine you.
Yeah, well, you see whatever he's going to say.
I'm not going to do anything just yet, don't worry.
All right.
Take a seat, sir.
Leave now. See, we've been married 54 years.
I'll stand out here for a little while. She was a good dancer as it goes when she was a bit younger. Mine, I've got two left feet, I have. Pat loved Elvis Presley so much. When he died, she went in mourning for over a week.
Do you mind if I call you Patricia?
Pat.
Pat. My name's James. I'm one of the doctors. Have we taken any blood yet?
No.
Do you mind if I take some blood now? Would that be all right? Yeah? I'll just get my gear. I'll be back in 1 second, OK? Bill, I'm just going to take some blood and have a chat with her. I won't examine her for about 10 or 15 minutes. So you're welcome to wait in there.
Oh, you miss me?
Yeah.
Was she pretty?
Yeah, she was pretty. She had a few boys chasing her, but she chose me. Don't know why.
So, just a sharp scratch.
Ow.
Sorry. What's brought you into hospital?
All I know is me legs keep giving out.
OK, again...
Bill will tell you.
So, you didn't feel lightheaded at all?
No, I don't suffer with anything like that. Bill!
What? Bill's just here,
I'm
don't
up
worry.
here.
OK. Do you remember hitting the floor?
No, no.
Pat, you didn't lose consciousness, and you remember being on the floor?
No, she don't.
I'll come and chat to you in a minute, is that right?
I've had a couple of gin and tonics.
OK. Do you have any other medical problems?
No.
10 years ago, she had a massive brain hemorrhage. That's what I was worried about, you know, when she went over today.
OK, I'm going to send these off, and then I'll come back and have a chat with you, OK? Good stuff.
Bill?
Yeah?
He can send me blood test off when he's coming back.
You all right?
He said, do you like Joppa gin? I said, yeah.
Yeah, you're not getting no more. I'm going to throw it all away.
You keep starting, I'm telling you.
I ain't starting, I'm just letting you know.
"63-year-old Mick was brought in with a head wound after being found alone in the street. Having sedated him to prevent further injuries, doctors can now scan his neck and brain.
Slightly up as we go. Ready, brace, slide. OK. Can we have our vent?
When I first saw him, he was drunk. My best friend worked at the same company as him, and she told me to go to the Christmas party. So I went, and I met him there. But then when he asked me out, he messed it up. He just said, "Oh, do you want to, can I ask you, will you?" He said, "No, start again, Mick." And then he started again, and he said, "Would you like to go out with me?" So I said, yes. He's just a social person. He just hasn't got that thing in his head that's to say stop. You know, he doesn't know when to stop, basically.
He's got a brain injury. If the brain injury continues, then he's in the right place. Because he's at the risk of, you know, continued edema at this moment.
He's always suffered with depression. He just gets a big black hole in front of him and he can't see any point in living. It's very difficult because there's nothing I can do apart from be here.
Right, troops. He's got a right shallow subdural, contusions both temporal and inferior frontal lobes. Fracture right temporal.
Mick's CT scan has revealed internal hemorrhaging to his brain. He will be admitted for an operation to reduce the risk of permanent brain damage.
Right, I'm just going to talk to his wife.
Yeah,
sure. Hello. As you know, he was found collapsed. We don't really know how, but he's got wound to his scalp, and he does a couple of bruises around his brain. He's probably going to wake up still a bit drunk. Yes. So the safest thing to do in this case is to wake them up slowly on critical care. Could you imagine if we took the tube out now and he goes to do Lally in half an hour's time? Yes. We won't know whether that's because he's just woken up and he's a bit drunk and disorientated and a bit leery, or whether it's because the bruise in his brain is getting bigger. So this is the safest way to do it.
OK.
Does that make sense? OK. Right, we'll come and find you. It's Pat, isn't it?
It is Pat, yes. Thank you very much.
We're going to medical, aren't we? Who's he coming in under?
Did you and Mick have any kids together?
I decided we wouldn't have any kids while we were living in a flat. And we never moved out, so we never had kids. He would have been a good father. He would have been really soppy. He wouldn't have ever said no. He would have been a good dad. He would.
We're going up now if you'd like to come with us. Sorry, John. Are you going to come, Kev?
So this is new to me. I had chest pains. So like when I inhale my chest cavity, it really hurts. And as it's progressed, I've got strong numbness in my hands, and I can feel it in my teeth and in my face.
This vending machine's evil.
Do you know what, yeah? No Rolos in it, yeah? I forgot they existed at one point in life.
They're not really that nice, though.
They are, man. Rolos are bad.
Just to put my mind at ease, I watch too many TV shows and read too many books. I don't want to be like a stroke or none of that kind of crap.
You don't read enough books.
Okay.
You need to read some more books.
Okay.
Hello, Kings A&E. Yeah. Yeah. 5 minutes, lovely. Thank you, bye. Chest pain.
Red phone, 5 minutes, red phone, 5 minutes.
A 50-year-old man is being rushed to King's with a suspected heart attack.
Yeah, chest pain, yes please.
Mechanical engineer Graeme has been brought in with his brother and business partner, Tony, after complaining of chest pains at work.
Right, hiya.
This is Graeme. Graeme woke up at 6 o'clock this morning with a bit of tightness in his chest, varied in intensity throughout the day.
Has he had GTN?
He has.
Right, woke up at 6 o'clock, Des. With chest tightness, which has got worse throughout the day, radiating into his jaw, neck, and both shoulders and upper back.
I've never had a heart attack, but I know that people describe it in various different ways. Very often described as a belt around their chest or somebody actually sitting on their chest. Hey, Graeme, is it? Good. I'm Des, I'm one of the A&E consultants. What's been going on? Tell me.
It's hard to describe it. It just started coming on.
Yeah.
It feels like it feels like someone's standing on you.
Okay. Have you ever had this before today?
I have.
Yeah, and have you seen anyone about it?
No.
Okay, all right. A couple of gentle, deep breaths in and out for me. That's it. Good. Men are a silly breed when it comes to health. Men tend to ignore very obvious warning signs for a long time before doing anything about it. Have you noticed anything that's made this better or worse, or just does its own thing?
I'm a bit concerned it might be to do with stress, worrying about things.
It may well be stress-related, but I got to assume that this is coming from your heart until I know that it's not coming from your heart.
Okay.
If you have multiple episodes of heart attacks that is causing damage to the heart, the muscle of the heart, that damage is irreversible. Gentleman with chest pains since this morning, about 6 o'clock. Normally CG, waiting for his troponin. I'm not going anywhere, so I'll follow up on the result of his troponin and whether he comes in or he goes home.
Hello, Tarek, it's Ellen. I'm calling from A&E. It's not for me, but my boyfriend had a little accident. We're still just like waiting to be seen, and I don't really know what to do about like tomorrow. Obviously, I'm going to come in. Yeah, cool, will do. Okay, cool. Thank you. Bye. Bye.
I always got told when I was growing up, if I kept playing with it, it would fall off.
And every time you do, a kitten dies.
50-year-old Graeme is suffering with chest pains. He's under observation to establish whether he's had a heart attack.
Heartbeat's gone down. Your heartbeat's going real down. It hasn't changed at all. So I don't know what I am. What do you know I am?
Yeah.
It might. Who's sticking the middle finger? Boy, does Graeme love gadgets. You know, technology, he loves it. You know, in the 80s, we were the boys that had the toys. Done the water skiing and the motorbikes and the Hells Angels rallies. We've done everything. And we had good times together.
89.
So you see the same as me, isn't it? I'm 99, look. I'm 99, so you're actually lower than me.
No, not you're 88, not the green bit.
So what's 99 bit then? And Friday night and Saturday nights, we were always out. Around all the trendy bars and into Bermondsey and all the funny haircuts and the dyed hair and We had it all, the clothes. It was the 80s.
Go on, bung it back on.
No, they're not going to put it back on. It's got to be deflated, isn't it? I don't know how you deflate it. You got to pop it. We shared a room, half each, literally half each. And it was the worst boys' room you could ever imagine. My mum would not go in there. She would not tidy it up. That's the boys' room, leave it. But when he moved out with Gina, I got everything and just threw it all down a scrap, all down a tip. Got rid of all of it. No, Babette. Hello, Claire. Gina, all right?
Graham's wife Gina and daughter Claire have arrived in resus.
I don't know.
I was instantly attracted to him. As I looked at him, I knew he was going to be my husband. I think I'd only sort of seen him 3 times and spent maybe the total of 2 weeks with him before I decided that I was going to come and live with him. And so we've been together 26 years now. Give me a kiss. I came from Jamaica to visit my nan. She picked me up and the car broke down. And she phoned Tony and Graeme and they came to pick us up. And that's how I met Graeme.
Ah, Des. How are we getting on?
So the tracing of your heart that we've done, the first one, looks completely fine. And it's the same as the one that the ambulance people did as well. That's completely fine as well. I'm still waiting for the rest of your blood tests and stuff to come back, and they will be really what will determine what happens from here on in. So we'll have a look at those blood tests and see, do you need to stay, or can we send you home and see how your heart behaves?
Much appreciated.
Yeah,
no fantastic.
Thank you.
Pat was brought into A&E after losing consciousness at home. Doctors are studying her blood test results to find out why she has collapsed.
Can I ask you about it quickly? Is that all right?
Yeah.
She was unconscious, no fitting. She was flat for somewhere between kind of 3 and 5 minutes, and when she came round, she was fast negative. She seems objectively a little bit kind of woozy and
Okay, is there any lateralising neurology?
Bill, bring me bottle in.
Yeah, tomorrow. Go to sleep for a while.
Patients with head injuries are tricky customers, and they're the people who we need to watch. It's not that they get worse, but they become different. And sometimes that's all there is to suggest that there is something serious going on inside their head.
Something else is going on.
Something else is going on. They see what the actual lab sodium is.
Just go in the bedroom, that's all you got to do.
You're in hospital.
OK, right. Pat, I'm going to have a look at the nerves in your face and then your arms and your legs, OK? Is that right? But I'm going to have to ask you to follow a series of commands for me. Is that OK? Can I ask you to follow my finger with your eyes? Ready? Very good. Any double vision? No? And what if we go this way, Pat?
10 years ago, she fell out the bleeding bed and she smashed her head against the wardrobe and she ended up with a massive brain hemorrhage. What we was worried about, how long she was in that coma for and she could have turned into a vegetable, like, you know, and I wouldn't like to have seen that. God, I don't think I could have been able to handle that. She lost use of her legs, her arms, her speech, and I panicked.
Keep your head still for me and just follow my finger upwards. Pat, can you follow my finger upwards? My finger, I need you to follow it with your eyes, OK? OK.
She keeps asking for a water bottle, it ain't here.
It's right outside of me bed. You don't have to look for that, Bill.
Is this
It's
normally
just at the side of me bed.
Is this normally how she acts after she's been drinking or not?
Weston, I've never known her like this before.
Okay, I think we're going to have to do a scan of her head.
Yeah, I would. Yeah, I think so.
I think we're going to have to.
Yeah.
Okay?
Yeah.
All right, then. Right, I'm back in a second, okay?
You're all right, mate.
Pat's test results indicate that her confusion is a result of something other than alcohol. A CT scan will tell doctors whether she has suffered a brain injury.
Well, you always fear the worst, don't you? And when the doctor said, oh, don't look too clever, I thought, oh, here we go. Not again.
Oh, hi, is that radiology? Hi there. I'm calling to request a CT head on a patient. She's in Majors Bay 12. Thanks very much indeed. Cheers, bye.
I just want Nutella. N-U-T-E-L-L-A.
Nutella.
In reception, 21-year-old Chris has been assessed by the triage nurse. He's waiting to see a doctor.
All right, question. Superman versus Hulk. Yeah, who will win?
Hulk.
Superman.
Hulk can't die. Hulk can't die.
No,
Hulk can't die.
What do you mean Hulk can't die?
I mean it exactly as it said. Can I not have a preference?
Superman is the best superhero.
But
I just don't like his uniform.
yeah,
Why France?
at least Iron Man has swag. Do you know what I mean? He has no swag.
Christopher Restrepo?
Right here.
I'm sure, fam.
You right? Yes, mate. Oh, thank you.
Hey, which one's Chris?
I am.
Oh, right, okay, sorry. There might not be enough room for all you guys. It's just a small cubicle, but we'll try and scram you all in.
Okay.
Grab a seat.
All right, thank you.
Hi. Right, Chris, what's been going on?
Basically, earlier today, I just felt pain in my chest, and then I had shortness of breath. When I brushed my teeth, I had coughed quite severely and spat out blood.
After you brush your teeth?
Yeah, just in general, yeah.
You're just not sticking your brush down a bit far. I think that's what it sounded like.
Oh, no, definitely
it's
not that, no.
It just somehow, all of a sudden, you have a coughing fit, and at the end of that coughing fit, whatever comes up is pretty bloodstained, or has it never been bloodstained?
It's been bloodstained, sometimes it's been brown. I smoke a little bit as well, so it's been brown, I think maybe tar or what else.
How much do you smoke?
Ooh, 5 a day.
5 cigarettes a day.
Yeah.
Are they roll-ups?
Pardon me?
Are they roll-ups
Yeah,
or
roll-ups.
No, you're not. Let's put this top off and let's see where it goes. No worries. Okay, show me whereabouts this pain is. Okay. Yeah, what we're going to do is just going to whip you around for a quick chest X-ray. Okay. You're coughing bits and pieces up, and you've got some chest pain over here, which could be from an infection. So let's do that now. Slip your T-shirt back on.
Graeme is being closely monitored in resus. Dr. Des is studying his latest test results to establish the cause of his chest pains.
You got the pain back?
Starting.
Come in down, tell him.
No, it's nowhere near.
Try and take deep breaths and relax.
I'm not saying wrong, where it's just anxiety. I'm starting to get the hump of it because I can't decide what it is.
Listen, Graeme, you've had a warning. You're doing, what, 40, 50, 60 fags a day?
Graeme worries a lot. He definitely relied on the cigarettes, I think, for lots of things. He was probably out of control when it comes to cigarettes.
How do?
Yeah, I'm feeling all right.
Right.
Well,
Your bits and pieces, for the most part, have checked out. But one of the tests that we've done is abnormal. And it's the one test that, for us, holds the most importance. To me, in many ways, it confirms that the pain that you've had is coming from your heart.
The first thing going through my mind was, is he going to die? I don't want to be a widow at 45, I just don't. And he's got to survive, he's got to make it through this.
But I think we still need to do a couple of other tests to see, is it? And if it is, how bad is it? And then what can we do about it?
It was very scary for me, very scary. I don't know what I'd do without him.
Graeme's test results indicate that he's suffered a minor heart attack. He will be admitted to King's Cardiac Unit for specialist treatment.
So he's going to be admitted tonight or today.
Cannot deny, but I do feel semi-written off now.
Semi-written off? Okay.
Does that make sense?
Yes, it does. You're not alone. Most men of middle age have a moment of, I suppose, coming to terms with your own mortality. There comes a point, I think, in every man's life when changes may need to be made. I think very often it's more the changes that you need to make to your own lifestyle that are the hardest that we find to do. Nobody likes being told what to do, even when it is your own body that's telling you that you need to do it.
Thank you for the care.
Yeah, you're not written off. No.
Semi, I did say semi.
No, not even semi. No, not even semi. Don't worry about that. We'll get some work out of you yet.
Yeah. Thank you.
Right.
Thanks for everything.
All right, not at all. You're welcome. I stopped smoking in 2004, and I decided today's the day, and it was. That was it.
Was it hard or easy?
It was easier than I thought it was going to be, but it wasn't easy.
Take it easy, eh? Take it easy. Seeing Graeme in that state, I think you realise you're not here forever. Take it easy.
Thanks
You'll
for
be fine.
everything,
Listen, you'll be fine. People do pass on, and it's sad. Your friends and acquaintances come and go. Family, it's always there, isn't it? All right. Where are you, at the pub? Here's me brother. I wouldn't pick another one.
Could I have a porter to Majors, please? Porter to Majors, thank you. Tricia.
Yeah.
Are you all right? Let's pop this on you, my sweet.
Pat is being sent for a CT scan of her brain.
Number 12, CT, mate, please.
Doctors are concerned that her increasing confusion and disorientation are the result of an internal head injury.
It'll be a bit cold, all right, in here? It'll be a little bit chilly for you. OK, on your call.
Yeah, on, slide ready.
On your call.
Ready.
Oh!
That's it.
It's OK, she's got
Rest
earrings
down.
in. Nice lady. Very nice couple.
What's the nicest thing about Pat?
She's my best mate. She's been a good mother to my children, like, you know, and been lovely. Don't get me wrong, it ain't been smooth like all the time. Pat lost a brother through drowning. I think Pat was about 16 at the time. Anyway, we've been out to have a drink. It was on a Christmas Eve. He's had a row with his girlfriend, and we had a canal where we used to live. He threw himself in the canal. I went in there after him, but I couldn't get him out. I don't think she's really got over that, really.
Will she talk to you about it?
Mostly, if it comes round about Christmas time, she might mention it. Or she's had one too many, like, you know, it upsets her, and she'll say, oh, my Billy, like, you know.
She's got a head injury, so I don't know if she had something happen before.
OK.
But that, or whether that's as
Yeah.
a result, she's
Right.
collapsed. So.
OK.
All done, well
All done, Patricia.
Hands down for me, that's it.
there, mate?
You all right, mate?
Yeah, she's back now, OK?
Yeah.
Who's making all that noise? Hey, it's just the trolley, that's all. It's only the trolley. It's OK, mate, no problem, all right?
Yeah. You all right, mate?
Oh, fall asleep.
Well, go to sleep then for a while. Hey? That's it, go to sleep, mate.
You know, every 1 year I walk past us, see the food and just smile.
Yeah, Chris.
Hello.
Should we come?
Well, your chest X-ray looks just beautiful, yeah. So there's absolutely nothing to worry about with that at all. If you get this pain back, yeah, just take what you've done today, which is just ibuprofen and paracetamol. Smoke a bit less, and everybody's happy. But this is just all insurance.
So I have to smoke less.
Yeah, always.
Stop smoking.
Give it a go. Give it a go.
Chris, you know what he looks like? Superman.
I think they like you. Thank you very much. Yeah, sorry, what's your name?
Matt.
Matt, thank you very much. Yeah.
All right, later, mate.
See you later.
Which one are we going? The food's that way.
See you later, yeah? All right, in a bit, fam. Cool.
Majors. Hello, Sarah, it's Jim. I've got a patient to refer. She has an 11mm subdural collection with no midline shift. I've spoken to the neurosurgeons.
Give me your bottle, Bill.
When she lay back, go back to sleep. You're knackered. That's it, go to sleep, mate. All right? Just shut your eyes.
Do you want to see her here up on the ward? OK. Thank you so much, Sarah. Cheers now, bye. She has a bleed.
Really?
Yeah. Can I just have a quick chat with you next door? Is that all right? Right. Since Pat's come in, I think we've seen that she's got kind of more and more confused. And I think what was worrying is the fact that this confusion has been getting kind of worse over the period that she's been in the department. Yeah. So that's why we did the scan of her head. Now, looking at the scan of the head, there is evidence that there's some bleeding going on inside the brain.
Oh, golly.
Now, she doesn't need an operation, but she may need one in the future. It's difficult to say.
Right, thanks for coming out with it. Thank you, help me. Oh, dear. I'm not saying I've had this trouble with her before, like, you know, but that was a really bad one, like, you know.
I think I don't want to give you kind of any
No.
reassurances, but I don't
you know,
think this is as severe as that,
well,
to be honest.
I think I've done the right thing bringing her up here, didn't I?
Yeah,
Otherwise, I could have left it and, you know.
Yeah.
Anyway, thanks for your help, anyway.
There's no doubt you've done the right thing. Yeah. Have you got any questions for me at all?
Just look after. Thanks, please.
We'll do our absolute best.
I've been here too long, 54 years. Anyway, thank you very much.
Not a problem.
Got me bottle round there.
You what, mate?
Me bottle, Bill.
Pat, hello. We are still going to have to admit you to the hospital and keep an eye on you. Is that all right? OK. Listen, if there's anything I can do, just give me a shout, yeah? OK. Take care.
Oh, thank you, Doctor.
Cheers, Bill. Thanks.
Right. Good job I did bring you up here enough, isn't it?
Yeah. Hello there, mate.
You're all right, mate, yeah.
All
All right, Pat's all going to make a move now, Gil. All right. See you later then, mate, love. See you later.
Right.
Thank you.
OK.
I was told it's a very lucky man, really, when you fall on your head, like, you know. But then as last my mate said, it shouldn't have done you any damage. Haven't had a drink since. It's done me a favour, really. And it's, the missus is a lot happier as well.
And you stopped smoking?
Yes, lots of positive things have come out of this experience, and that is one of them, which is really, really good for me. I'm really pleased, and everybody else is pleased as well. And so is my pocket.
Went from the bonnet, found face down on the floor.
2, 3.
Paediatric trauma.
It's a stabbing, Cordray.
25 feet from a ladder onto his back.
He's really unwell. I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
Kings A&E, how may I help?
Kings College Hospital, London.
I got stabbed. I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toes, head, chest, abdomen.
A place where love, life, and loss.
Don't bloody die. I love you too much for you to die.
Unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
I've got plaster, love. Yeah, fracture.
That'd be me who'd end up in hospital on Mother's Day, isn't it?
Adult stroke call, ETA 10 minutes. Adult stroke call, ETA 10 minutes.
Which cubicle can that go into?
6.
6.
It's Mother's Day at King's. Dr. Robeil is the consultant on duty in resus.
Okay, heart rate's come down a bit, that's good.
When I'm at work, everything outside the hospital doesn't exist for me. Weekends are usually more unpredictable, but it was probably busier than what I expected.
Okay, let's take some C-spine precautions as well for the time being. Yep.
Male or female? What is it?
What do we have? Yep.
There are times when trying to figure out what's going on is incredibly difficult. Families do come into it because they're an extension to that patient. and they matter as well as the patient. Okay. I get incredibly nervous, especially when there's no relative or friends that comes along with them.
It's Mother's Day, everyone should be at home cooking for their mummies. They're not.
Hey, sister. Yeah, good, thank you.
Adult trauma call, ETA 5 minutes. That's an adult trauma call, ETA 5 minutes.
A builder is being rushed to Kings by paramedics.
Right, let's prep.
23-year-old Jamie has fallen from the roof of a 3-story building.
So we need ventilator, we need drugs, we need propofol infusion. Fell 25 feet from a ladder onto his back onto a wall, complaining of severe back pain on Entonox. I suppose a bad day is when you have to tell a family member that their family has been hurt in a terrible accident, and you have to go and tell them and describe some of the injuries that they've had. And imagine saying that on Mother's Day, phoning up their mum and saying, your son's been in an accident, this is what's happened to them, and that can be incredibly difficult.
Trauma?
Here we go.
Yeah, this is Jamie. He was up on the roof doing some roof work. It's a 3-story building. He slipped off the roof, tried to grab the ladder, but he's landed on there was like a 6-foot wall between the neighbours' gardens, and he's landed sort of right-sided and on his back. Excruciating pain, very pale, very sweaty when we got to him. But he's complaining of a lot of pain from his back, from here all the way down the middle, all around his right side, all around his shoulder.
Everything that we do can impact the patient's life dramatically.
Can you feel my touching here? Yeah.
It's a lot of baggage, but that's why I go home and play computer games. People do have to find ways of go home and sometimes just forget about it and relax.
He is reluctant to take a deep breath in because of pain on the right side of his chest. He has tenderness over right anterior and lateral ribs.
Yeah, it is. You can use that for 3rd floor onto a brick wall. That's impressive. It's a dangerous job. What we need to do is get you off this hardboard, okay? And then we can examine your back, and then what we'll do a CT scan of your back and your chest, okay? Right. I've got 1, 2, 3.
Then we will be off. You have to start unstrapping.
You don't move, we'll do the moving. I suppose when someone comes in and they've been in trauma and they're complaining of severe back pain, you're really worried whether they've done their spine and whether they've got spinal fractures.
Ready, brace, roll.
Take the board off.
Down an inch or so as the board comes out now. You're nice and secure.
You've got to be very careful because you move them the wrong way and that bony fragment could tear into their spine and cause them permanent damage.
Ready, brace, down.
Does anyone know you're here? Yeah. Your family and someone knows? Good. Okay.
Doctors are performing an emergency ultrasound to determine whether Jamie has suffered any internal injuries.
I'm sure he's just going to have a few fractures, isn't he? Either that or something horrendous. The worst case scenario is they've cut their spinal cord and they can't walk ever again, and that's something we're not going to be able to repair.
Crying now for 25 minutes, 20 minutes, 20 minutes.
4-month-old Weston has had diarrhoea and vomiting for over 24 hours. He's been brought in by new parents, Nina and Jason.
I know. He's looking at me like, what are you doing?
I know.
Every time I go near him, he's like that. Come here. Oh.
Jason and I met via the internet dating. We met in a pub locally. I found the whole internet dating experience horrendous.
She says that she only really agreed to have a date with me because we lived in the same postcode.
We met in the pub around the corner and he... Well, initially, actually, I wasn't bowled over, but he was a grower. He was a grower.
My first impression of Nina. Funnily enough, you know, they say you never judge a book by its cover. I actually thought, and I've nothing to base this on, but I actually thought she could be quite hard work.
And I had in my mind I wanted to get back in time to watch Jonathan Ross. So we came back to my house, which I wouldn't normally do, and we watched Jonathan Ross together.
We had a lot of fun for the next few weeks and just never really looked back. Monster. It's better. I'm not sure if you're looking for a different thing when you meet at that age, but you definitely know what you do and don't want.
I wanted to meet someone so I could have a child or try to have children. Having children became very important to me when I was in my mid-30s. Suddenly the panic sets in at like 35. You know, is it going to happen? Because I was 35 and single. My panic was largely around actually meeting somebody. Fortunately, Jason came along when I was 37, so just in the nick of time.
She's really, really good fun. She doesn't take herself seriously at all. She's got a great sense of humour and she can really laugh at herself, which is priceless. Yeah. Happy Mother's Day.
I have another patient, I'm afraid. We've got a 23-year-old who was on a roof doing some roof work. He fell 3 floors onto a brick wall. So we wanted to get a CT, C-spine, chest, abdo-pelvis. Okay.
Builder Jamie is being sent for an urgent CT scan.
2 of you on this side, please, just for the log roll. Ready, steady, slide.
Doctors are concerned he may have suffered injuries to his internal organs, as well as fractures to his ribs and spine.
It's a bit of a lucky boy. But I expected him to have a lot more injuries, considering how high he fell. I mean, he doesn't have very much bruising on the outside, but tender over his ribs.
Want me to take his head, or you
I'll take his head. When people do come in alone, it can be quite difficult. When patients have families around them, they do provide a big family support and emotional support. I'm coming, I'm coming. The way I kind of look at patients is that treat the individual as if they were your family member and how you would want them to be treated. Right, so they had another quick look. We're still waiting for the formal report. Only injury so far is you've punctured your lung on the right-hand side where all the pain is. Yeah. And that's probably because you've got a rib fracture there. What we need to do is put a tube in to get the air out. Okay? Yeah.
Any other good ones?
Yeah, he's got a hemopneumothorax.
From what?
That's the 3rd chest drain we've put in today.
Oh. Don't worry, Jamie, I'm here to hold your hand. Jamie, it will be painful, okay?
Yeah.
I have to just... So you need to squeeze my hand as much as you can. Don't worry, you won't.
I don't think you ever grow out of wanting your mum or needing your mum. That's always there.
If I was to have a medal, it would be best hand holder. We'll tell you everything that's going to happen, OK? If you want to. If you don't, then just tell us all to be quiet.
Adults can be very vulnerable just as children when they're alone in the hospital. They can be equally scared, they can be equally petrified about what's happening. And you've got to put yourself in that position and appreciate what they're going through at the time.
So have you got any other hobbies?
Fishing.
Squish, squish, fishing?
Yeah.
My partner is a massive fisherman, you know. I haven't been fishing ever since when I went with him after a night shift. Someone was having a heart attack at the lake. So I feel like I'm a bad omen for the fishing, so now I just don't go. Squeeze, squeeze, squeeze. It's all right, you can squeeze harder than that. I can take it from the north. Squeeze, squeeze, squeeze. You're doing really, really well. Squeeze, 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 squeeze. I must say, I think that was the bravest chest strain I think I've ever actually seen. There you go, perfect. Are you feeling okay?
Yeah, I feel all right, yeah.
So you're looking a little bit peaky, sweetheart. Might treat you with a bit of painkiller now, you know.
Yeah.
What techniques do you know?
I don't.
Okay. So external rotation, boom.
So what does that do then?
Because you bring the scapula over the shoulder.
Find it.
Okay, so you just force
Yeah.
it there. Okay.
80-year-old Daphne has dislocated her hip whilst putting on a sock. She's come into Kings with her daughter Jill.
I mean, it's not great to be in hospital any day, but to be in hospital on a day that's significant to you is probably a bit more of a downer. Veins are beautiful.
Thank goodness for that.
Pardon?
I said, thank goodness for that.
I know. And to have that day taken away from you, it can't be what you imagined to happen when you got out of bed that day. Okay, sharp scratch. Well done. So what were your plans for today?
It's Mother's Day today, isn't it?
It is. Happy Mother's Day.
You wanted to trip out. You got one.
I don't think this was the one you planned, though, was it?
Really?
My mum is probably the strongest character in my family. She's a matriarch. Hello, A&E recess. She was very disciplinarian, very strict. Other people go home from work and they get the washing done for them, they get cooked for, they get mothered. I go home and I work at the takeaway. Every time I phone home, I get told it's been too long since I last phoned. There's always a comment about my weight. She'd probably be one of those people who'd call me after a hospital admission and say, by the way, I was in hospital for this, whereas I'd want to be there. How you doing?
Hello. You look as if you've got some bad news.
Well, you know the bad news.
It's dislocated.
It's dislocated. I'm going to speak to the bone specialists here and ask them their advice, because you're a special case.
You can see she's like the bionic woman with all
You
that
are?
metal there, yeah.
I'm not sure how much residual bone is there. Look.
Not a pretty picture, is it?
Do you cause havoc when you're at the airport?
Go through the, yeah.
I need to ring my mum.
Yeah, you must. You're very far away.
Liverpool.
Oh.
So, yeah.
looks much better. He's not soiled himself since we got here. This morning, when I got up, I changed him 3 times in about an hour.
I changed him lots last night, so I just all watery. He kept doing the horrible farty sounds, and I looked and it was just
Comedy fart noise.
Weston?
Can you grab that?
4-month-old Weston is being examined to find out the cause of his diarrhea and vomiting.
Hi, morning.
Hi, how are you?
Just take a seat here. Hi, how are you?
She looks a bit brighter.
Yeah, okay. Tell me about him.
He was unusually windy for about 4 or 5 days. He had quite a bit of distress. Had a terrible night last night. He was awake every half an hour. And he's had really, really bad diarrhea. Huge. It was everything. He just come and he was head to...
But the diarrhea came first.
The diarrhea started, yeah.
Diarrhea. He's had diarrhea for 24 hours.
And today, the stool has been as watery and...
Oh, yeah. He's since...
Would you mind undressing him?
No, of course not.
We had to change him about 3 times in the night.
OK.
Weston is Nina and Jason's only child. He was born after a 2-year struggle to conceive.
You can't help feeling a little bit of like, when is it going to be my turn? You spend a lot of time being happy for other people and just hoping that your turn would come and waiting to be happy for yourself. He seems a bit better, doesn't he? He's definitely lost weight.
You think he's lost weight?
It's probably much needed. Yeah, of course, there was, a few months when I shed a few tears, but fortunately, Jason kind of cheered us along through the whole process, and yeah, we got there.
Nina's a brilliant mother. Absolutely adores him. She can't do enough for him. She spoils him. She really does spoil him. I have to keep telling her off. And she's always buying him. Weston's going to be the best dressed kid in southeast London.
Oh yes. You're trying to talk to me?
Yeah, he's quite a chatty little fella.
People do complain about their kids, the lack of sleep. It doesn't bother me. He can wake me up 20 times a night. I don't care. I don't care how many nappies are changed. I don't care how many times he's sick. I don't care if my favourite dress is ruined. I'm just so lucky to have him.
I think it's very likely that he had norovirus infection. Norovirus. N-O-R-O.
Okay.
I'll go and get a prescription.
Lovely,
yeah?
thank you very much. I'm not eating for 6 hours. You can't have nothing to eat for 6 hours.
That shut his arm off. You can just kind of feel it when they're together. How much she actually does love him. It'd be interesting actually to see what she's like when he starts being a little bit naughty. How she'll kind of discipline him. Because I've got a feeling that she'll be a terrible disciplinarian. I think she'll be incredibly soft with him. So that'll be my task, no doubt.
This way?
Okay, keys, sedation. The mask is there. So what we're going to do is give you some stuff to make you kind of a little bit drowsy.
Yeah.
Yep. And then we'll let the boys work their magic. All right? We'll give you some oxygen as well. That's all right.
In resus, doctors are sedating 80-year-old Daphne. They can then safely reposition her hip.
Yeah, OK, I'll wait over in the room, OK. Well, fingers crossed.
Okay, so we know where our airway trolley is if we need it. Okay. I'll give you a lovely mask to wear. Lift your head up. Forward. Forward. There we go. Is that comfortable for you? How are you feeling? Good? So we're going to give you lots of oxygen. You let us know if there's any pain or anything, OK? Okay, we're going to get started, all right? Okay, you're going to start feeling a little bit woozy, okay? Okay, relax, relax, relax. Are you okay? Are you all right? Relax for me, Daphne.
It's okay. I'm listening.
What's up?
I'm listening.
You're listening? Okay.
Yeah, I'm listening.
You're just making some funny movements at the moment. Daphne? You still with us, Daphne? Daphne? You still with us, Daphne? Daphne? There we go. CO2. Okay, we're just going to press on your hips, okay? Let us know if it hurts. I've got you.
Sorry about that. Oh.
That's all right.
Oh.
Well done, Daphne.
Yeah, that's not a real...
Daphne? Daphne?
I got great faith in you.
Okay, it's all done, Daphne. It's all done. It's finished. We've got it back in.
I'm very impressed with the staff at Kings College.
Oh, that's lovely to hear.
The older generation are very stoic. They definitely don't want to be a burden, but I think inside, everyone wants to be cared for.
You'll remember this Mother's Day for a while, won't you?
I think it's really important to know that someone has family support.
So you're all dopey, are you?
You just see people wanting to recover more or wanting to get better when they've got their family there, and they've got the family there to support them.
I didn't even know it was done.
That's probably the
Were
sedation.
you kind of talking funny stuff when you were under?
Yeah.
I can have an X-ray now.
Yeah, and then you had a little bit of a wriggle.
Did I? Oh.
As long as she didn't hit you.
Did I
No, she didn't, but you were wriggling and I was
give
wondering-
away any secrets?
No state secrets.
Jamie was brought into A&E after falling off a roof. Doctors performed an emergency procedure to re-inflate his punctured lung.
How's it going, mate? I'll check that out. I can't do the other one. Don't do anything.
Jamie's mother and the rest of his family have joined him in resus.
Mum, that place. Fell off a roof.
That's not good, is it?
It's not good.
The hurt talking?
Yeah. It's hard.
Is he still in pain?
Yeah.
It's very difficult for any mum to keep their composure when their child has been hurt in a terrible accident. Even if you're 40 years old, it's still their child.
Be careful. This isn't the present I wanted.
I know, Mum. I'm so sorry.
Don't be daft. Are you really in pain?
Yeah.
Be
Nothing
strong,
like
be
it.
strong. You're alive.
Yeah.
People should be with their loved ones, even if it is once a year. And yes, you should love your parents every day and tell them you love them every day.
I just crushed all my ribs on the right hand side.
Have they confirmed that they're all broken?
Most of them, yeah.
Just one side?
Yeah, just my right side.
Does it put you off roofing?
Nah.
Nah. Do you want to go up or do you want to stay in the baby?
Thanks for all your help.
No, Rosa. Coming up.
Oh, you're coming up, are you? Sorry.
Yeah. Can't get rid of me that easy.
Jamie is being admitted to a ward for further treatment.
I'll get in a minute. About 100 miles an hour. Oh. You having trouble with your eye?
Yeah.
What is it?
I hit it.
Oh, really?
Yeah.
So it's sore?
Yeah.
Oh, they'll look after it.
Yeah, I'm sure they will.
What did you hit your eye with anyway?
Hairbrush.
Oh, that's...
It's a long story.
Yeah, speaking. Right, brother, I'll be there in a minute.
Oh, what are you doing?
I'll just pull my breeches up.
Oh, dear. You keep on losing your trousers.
No, you think I'm a stripper, wouldn't you?
I know.
Not us.
74-year-old David has been brought in with his wife, Margaret. He is suffering from dizziness and numbness to his arms.
Oh, excuse me.
For a couple of days before then, he'd been feeling swimmy. When he said that his hand was numb and he was still feeling giddy and he couldn't lift his arm up properly, then I thought, yeah, it's time to call somebody.
I'm just going to sit you up slightly, all right?
Yep.
And then I'm just going to test the movements of your face. Okay. And I want you to tell me when you feel it touching and if it feels the same on both sides, okay? So if you just close your eyes for me.
We've been married 48 and a half years. And the only times we've been apart is when either of us have been in hospital.
Have you noticed any difference in his speech at all when you're listening to him?
I haven't really noticed, but I'm hard of hearing. And
Okay.
quite
Yeah.
often I've got to ask him 2 or 3 times what he said anyway, so... I went to work in the post office telephones, as it was in those days, on the switchboard. In the south, they were short of telephonists. David's mother worked as a telephonist at Victoria, and I stayed with Dave's sister because she had a spare room. And of course, David sometimes he'd come and pick people up from the station and take them up to his sister's.
You always feel better when you come in hospital, don't you? You always feel better when you come in hospital than you do when you're at home.
Sorry, what did you say?
Can you sit there so I can see you?
That's an idea. We'd gone to Blackpool for a holiday and we were walking along the promenade. And he said, how would you like to be Mrs. Catchpole? So I said, yeah, OK. And he said, we'll get married next month. I said, we can't get married next month. I said, everybody will think I'm pregnant. And we went to Blackpool for our honeymoon. We went to see some shows and there was wrestling and there's always something going on in the tower. I mean, we've had quite a happy marriage, really.
Don't.
Get out of bed now, we could have sex. He's definitely the right man for me.
Bernard, I'm coming. Right, yeah. House. Oh, I'm just getting on my bike. I'll get here in a week.
I can wait for a week.
I'm coming. I'll speed it up.
Don't speed it up. Take it easy, okay?
Oh, I'll take it easy.
71-year-old Bernard suffers from glaucoma. He's come into Kings after running out of eye drops.
I'm getting it.
You're doing good.
Thank you, brother.
What brings you to Kings?
Well, what is it? I've been without drops.
How did you manage to do that?
Because I thought the woman would order them. She didn't order them this time.
Okay.
Well, because she was going away for a bit on the side.
All right.
With her boyfriend.
Can I have a quick look in your eyes? Is that okay?
No. My eyes are not 100%.
And see, you can just sit straight. You happy with
They're
that?
not too bad.
Let's put it there.
Bernard has been with his wife Linda for 40 years. He now lives alone in sheltered accommodation.
Yeah, we are. Yeah.
Well, I met my wife. And she was a very pretty woman.
And this one now. Keep looking straight.
I used to go to a club. And it was a social club. And she was one of the prettiest people there.
That's good. That's good. Okay. Thank you very much.
I said to her one day, do you want to come out for a drink? No. So I said, well, all right.
Do you mind closing your eyes for me?
So anyway, she came up to me 5 minutes later. She said, oh, all right then, you have to be sociable. So the boy done good.
Okay, sir. I will find the medicines for you. Come along.
Okay, thank you very much.
Yeah, come, keep going. Take a right. Well done.
We decided not to have children. You know, so we missed out there, really.
You can sit there.
Thank you.
No problem.
She had a psychiatric illness. And she's on 24 hours care. She lives in a care home. Oh, thank you. You're a diamond. Like that. I care a lot about her. But then I do wish I'd had a family. This when I was using the fork yesterday as well.
What, Dad?
I couldn't fill the fork properly yesterday.
No.
I forgot to say that.
Does it feel as though it's improving, though?
My fingertips are numb still.
Yeah.
They're dead, you know.
In Majors, David is being monitored after suffering a suspected stroke. His wife Margaret called an ambulance after he complained of numbness in his arms.
Hello, love.
Hello, Elsie. We're just talking about your Jack.
Oh, you're cold, love.
Freezing out, babe. One of the doctors just put...
Their friend Elsie has come to visit David after hearing of his admission to A&E.
Do you want to sit down, Elsie?
Oh, you sit. I'll get another chair.
Go on, Elsie.
Elsie.
There's another chair up there. Sit down. How do you feel?
Don't feel too bad now. It's just my fingertips are...
Still numb, are they?
Yeah.
I don't know why you're here, though.
Well, what happened, Elsie, is on Saturday, his arm was numb on all his fingers.
Yeah.
So I was looking in the medical book. I know you shouldn't...
Well, whether you do or you don't.
But it said in the medical book that giddiness and numbness, it could be the start of a stroke.
Oh.
So they sent the ambulance.
Yeah.
I get all tensed up because I don't know what to do for him. I can't describe it. I just get all tensed up. I just, in case I'm doing the wrong thing. I just don't know what to do. Sometimes I think, oh, perhaps I should have gone into the nursing profession and then I would have known what to do.
All right, love. I'll see you. Happy Mother's Day.
David and Margaret had been married for 10 years before having a child.
When you think it's not going to happen, you kind of put it to the back of your mind. Best not to worry about it, I think. We'd kind of more or less given up hope, and there were two elderly ladies on the ground floor, Anne and Julie. And when we called in on her, she said, would you like a turkey sandwich with sage and onion? I said, oh, yes, please. Well, a couple of days later, I started feeling terribly sick, and I thought it was the sandwich, but it wasn't. I was pregnant. So it was a real surprise. It was lovely, and he was a really happy baby. He really was. Every morning when he woke up, he used to have a big smile on his face.
Do you prefer being a mother or a grandmother?
Well, a grandmother, you can give them back when you're tired. but I enjoy both. I enjoyed both. Yeah, I loved having him, yeah. I don't like troubling them unnecessary, do you? But it's better that you were checked out.
I'll be glad to have a cup of tea.
You've had two. I've had none.
Yeah.
Bernard has now collected his eye medication and is waiting for transport home.
I haven't got it? No, yeah, I've got it, but I've got to wait for a cab now.
All right, okay.
Thanks.
My job is finished.
Oh, yes. Thanks for doing your job.
But eat something.
His wife suffers from mental illness and lives in a care home.
Well, even though she's got her illness, she's still very, very nice. And it's so good, you know, when I phone her up and she's so pleased to hear from me. That's good, you know, and it gives me a purpose in life. Mrs. Mop, excuse me, could I borrow your mop? Thank you very much.
And who looks after you, Bernard?
Me? Well, I think I'm all right. I think I'll get by, more or less. I don't mind being alone. I enjoy my company sometimes, you know, so I suppose that's, you know, I think that's fair enough. That's what happens in life, isn't it? Being alone.
How long have I been on those tablets, Margaret, for my waterworks?
Sorry?
How long have I been on those tablets for my waterworks?
I don't know. Time just goes so quick. Yeah, I suppose I am a worrier. In one sense, yeah. You think, oh, everything's all right until the next thing happens. He's my friend, and, as well as my husband and best pal. Everything, really.
Stop breathing for a second.
He sits on one side of the room and I sit the other, and I go, love you.
Pa, pa, pa. Da, da, da.
If you mouth colourful, it looks like you're saying, I love you. And sometimes I go, love you. And he'll say, yeah, you're colourful too.
I've had something called a TIA, or a mini stroke.
Oh, yeah.
Which is where temporarily there might be a little block in the vessel supplying a particular area of the brain.
Doctors have confirmed that David has suffered a minor stroke. He'll be referred to the stroke team and discharged to recover at home.
I would hate to be without him, I really would. Yeah. I don't know if I could go on without him, actually. I really don't.
Thank you very much for all the trouble. Bye-bye for now.
No, it's a stroke. But it's not one, really. It's just a small one.
I'll have to look after you better, dear. Perhaps I've not been
You've been doing this for 48 years, love.
Sorry?
You've been looking after me for 48 years.
When you're younger, you think, it's not going to happen to me. It's all these things that creep up on you. You think you're not going to get, but you end up getting them, whether you like it or not.
It's just one of those things that happens. And it's gonna come, and you've got to just live with it, sort of thing. Got to go as, one day at a time.
I don't want to be without him. I want to go first if there's anybody going. Or go together.
I hope we have another one. If we don't, life's going to be good anyway. You know, we've got a good one. We've got a good one, and I've got Jason, and that's it. I go and pick him up all the time if he just moans. I have him in bed with me, but I love it. I love having him in bed with us. He kind of pushes us both to the sides of the bed. I need to learn not to spoil him, and currently I think I probably could be accused of spoiling him.
I used to have a crush on this boy when I was younger. And I always tell him he doesn't kiss as good as he did.
Went from the bonnet, found face down on the floor.
Paediatric trauma.
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell. I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
Kings A&E, how may I help?
Kings College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toes, head, chest, abdomen.
A place where love, life, and loss.
Don't bloody die. I love you too much for you to die.
Unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam.
Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
because there may come a time when you're not around to tell them.
That you, Al? I brought myself down to A&E. Well, I thought I'd better get a check-up because my other eye's gone black as well. No, I'm all right. It's quiet, hardly anybody here. No, I'm all right. I'll give you a ring when I'm on my way out, all right? All right, Al? Yeah, bye.
Look how much calmer it is today. Yesterday was...
Hey, no, hang on a sec. We have had 9 patients in here this morning.
We've just had 12.
The whole day yesterday was worse.
It was
but we've done a good clear-out.
Any arrests or good traumas?
No.
Dr. Matt has just started a 9-hour shift in resus.
I grew up in a very, very strict household. We were very risk-averse as a family. It was school Monday to Friday, and then on Saturday I had to go to Chinese school, and then on Sunday I had to go to Sunday school, so it was a lot of education. As a teenager, I was quite frustrated because of not having the normal childhood.
I'm going to leave you...
I'll do this now.
Yeah.
Okay.
Are you happy with that? And I'll sort out bed 9.
Okay.
But when I was a student, it was a completely different life. I went bungee jumping, I went skydiving, and I never really thought I could die on the end of a bungee wire. When you work in a busy trauma centre and you see all these people coming in with the head injuries or with car accidents, you build up a picture that that's what's happening all the time.
Oh, there's not been a red phone in about an hour. Normally that's all it takes for the red phone to actually ring. I need to stop opening my mouth.
You, I'm going to ban you from A&E.
Stop doing things wrong.
Definitely. Hello, Kings A&E. Hello. Yep. Okay. All right, how far away are you? Okay, thank you. Bye.
Pediatric trauma, 10 minutes. Pediatric trauma, 10 minutes.
There's a 16-year-old male coming in with Kent Hems. He's intubated and ventilated. Do you want to go direct to CT? All right, bye. Hello, could you put out a pediatric trauma call for 6 minutes' time? Thank you, bye.
Head and face injuries, intubated and ventilated, GCS 7.
A 16-year-old boy is on his way to King's. He fell 14 feet, landing on his face at a skate park.
Okay, watch your back, please. Watch your back. Hey, you are anaesthetist.
Hi. Is that what I think it is, a push bike helmet? scooter.
Consultant Sharon is in charge of all major trauma patients arriving in Resus today. She'll be supported by Dr. Matt.
Thank you very much.
Okay. This is Max, who is on a scooter in an indoor skateboard park, and he was at the top of a half pipe, which apparently is 12 foot high, and he was seen to land on his face forward, wearing a helmet. He was seen on the CCTV to remain motionless for about 30 seconds, but then he started moving and becoming quite agitated. The crew on scene believe he may have had some periods of apnea, though not witnessed by us. On our arrival, he had a GCS of 7 with a motor score of 4. His pupils were equal, although not that very reactive. He's got an obvious mid-face fracture, probably the maxilla. He had an RSI, grade 1 intubation, 2 IV cannulas, and we brought him straight to you.
Air entry bilaterally. I'm going to listen to the sides now.
Can you book me a head and neck CT? We'll do a chest and pelvis X-ray, a plain X-ray.
Head injuries can be so devastating. I've seen people die from falling from their own height. You worry about whether or not there's blood inside the brain or any kind of significant force which could cause a traumatic brain injury.
We've got a young man who was skateboarding and fell off and was seen to fall on his face and wasn't moving and then started to move again, so we don't know how long he was apneic. He definitely needs a head to pelvis CT.
Not that cold.
Well, he's fallen about 14 feet onto concrete, so he's probably going quite fast. He's got the mechanism of injury. All right.
The impact to Max's brain is similar to the effects of being hit in the face at over 20 miles an hour.
You never really know what's going on inside their head. And because you've got such a confined space, the amount of force and the amount of injuries that you can sustain in someone's skull, you're racing against the clock because their brain is swelling inside their head and something needs to be done.
Go home.
You can't just go home.
I'll just lie down for
actually
a few
walk.
days. I'll just lie down for a few days.
You need to have an X-ray. Hector! Yeah, that's us. Don't move.
13-year-old Hector has come to Kings with his mum Kirsty. He's badly injured his hip while playing football.
Either way, it's not easy. You are marvellous. Right. OK, now, can you stand on that at all?
Not really, no.
Can you get onto the bed?
Probably.
Have a go. With a bit of assistance? Yeah. Right, let me shut the door.
Which side is it? It's this right hip.
Yeah, my name's Ling, by the way, one of the doctors. Nice to meet you. Your mum?
Yes.
OK, good. You're Hector. Brilliant.
Oh.
Well done.
If you want, can you lift? Just don't fall off. OK.
That's excellent. OK, do you want me to help lift your legs up onto it? Yeah. OK, right, swiveling round, swiveling round. It's probably getting stiffer and stiffer, isn't it?
3 children. Hector, who's my oldest, he's 13. Tallulah, who's my middle one, she's 11. And my afterthought, in a delicious way, Una, who's 4.
Tell me what happened.
Oh, I was playing football, and as I wanted to kick the ball, well, I was going through the kick, and I just felt a ping
in
my leg, and I just fell straight on the floor. I couldn't get back up for about 20 minutes.
Where did you feel the ping?
About here, well, in my hip, and then it started hurting in my knee.
And up to date with injections, immunisation?
Yeah.
Growing well?
Yes.
Yeah.
And how old are you now? 13, you're at, like, normal school?
Yeah.
And getting on well at school and all the rest of that? Brilliant. Okay.
Boys are simpler. They're not too complicated, and they actually just want to have a good time. And, well, Hector's like that anyway. He just wants everybody to be happy and to have a good time.
Right, let's see what you can do. Straighten this leg for me.
That hurts quite a lot.
Okay. I'm just going to have a little feel of your hip.
It's fine there.
It's fine on that side?
Yeah.
It's going to have a feel over the top. What we need to do is just get an X-ray of your hip and your pelvis. What can sometimes happen from that kind of move of kicking your leg is that your muscles get very tense and they can sometimes just pull off a little bit of bone from your hip. And that can really happen anywhere in your body, but on footballers this is where you commonly see because of the mechanism.
He used to get into trouble. He used to get into trouble quite a lot. He didn't really have any fear for adults. 5 years old, he threw a shoe at a teacher because he didn't really agree with what they were saying, and it was in his hand, and he got cross, and so he threw it. And then he was off school for a day. This is like a different boy in public than the one that is sitting on the sofa with me. I think most teenage boys start to get very aware of their place, the relationship with their father, their relationship with their peers. They're kind of all finding their little space in life, you know, and how big am I compared to them? How much front has that one got? You know, this whole world out there that I don't know.
16-year-old Max fell face first onto concrete at a skate park. Flown to Kings by air ambulance, doctors need to ensure he is stable before taking him to CT.
Airway's fine.
Breathing's fine.
Trachea's central.
Trachea's central. Chest is clear.
Is ventilating okay?
Yep.
His parents, Steve and Tracy, are being brought to Kings in a police car from the site of the accident, over 60 miles away.
Can we actually up the tidal volume just a bit on that, because we don't know what the disparity is. All right, we've got a pulse of 55, which is slow, but he's probably quite a fit guy. We've got a reasonable blood pressure, not too high, not too low. Yeah, quite cold around there. What is his core temp? We haven't done that yet, have we?
Do we have next of kin, family on the way?
It was about 10 to 4. I remember looking forward to there was a game of football on the telly I wanted to watch at 4 o'clock. Tracy was doing roast dinner. So perfect Sunday, really. I was going to go and pick him up from the skate park. And as I was driving down, I got a phone call from Tracy saying that Max had an accident. I didn't panic straight away because Max was always falling off his scooter and, you know, getting the odd cut and bruise here, there and everywhere. So, and I knew that his aunties and that were at the skate park because it was a nephew's birthday party. And when I turned up at the skate park, I saw Tracy's niece coming out crying, and then everyone was being sort of ushered out, and I could see all his little cousins and that crying, and I thought, you know, this is serious.
Hello? All right, bye. Shahana, they're ready. We've got the resus bag, we've got oxygen.
Oh, you're...
You know what that is, Matt? I'm
my
banning you
fault,
from recess
yes.
from now on.
Hello, Kings College Recess area.
Do you want the box, airway box?
The orange bag is the airway bag.
But do you want any drugs? No.
So we've got the rocking, which is probably the most important thing at the moment. Yep. Well, the fentanyl was there somewhere because we had to get the CDs out. Fentanyl.
I went in, the paramedics were rushing about. It's like slow motion. All the shouting and that was like echoing in my ears and that, and I looked round, everyone just sort of, everyone was in shock. I remember saying to Tracy's niece, don't let Tracy in here, don't let Tracy in here.
I told you I broke my brain. I told you I broke my brain.
He was crying. He was crying. He was crying like a baby.
I just cried a little bit, yeah.
Yeah.
And then it just started hurting and then...
Yeah? I think you break your elbow because you doesn't want to go to school.
No.
Yeah?
I never did that. I never did it on purpose.
You never did it on purpose? Oh.
I'm never gonna lie, I never did it on purpose.
Oh.
Even the teachers at school will have more sympathy
Yeah,
for me more than you have sympathy for me right now. Thank you,
Take your arm for what? Get away from school. So can you play tennis when you go to school tomorrow?
Yes.
You can
I
play.
can just use one arm.
You can play tennis, yeah?
I can just go boom.
So that means that you can't do your You can't do your writing and reading.
No.
What's it is?
No, because I have to rest.
Oh, if you can't play tennis, you can't do reading and writing.
I can't write.
Yes, you can write.
I can't.
All you have to do is press your elbow. Press your elbow on the desk. The teacher will help you.
"19 minutes after Max's arrival at King's, he's being brought to CT where the extent of his injuries, particularly to his brain, will be assessed.
His heart rate's 52, which is why it's alarming at the minute. So he needs to go to an ITU.
His parents are still travelling from their home in Eastbourne.
I always wanted a boy. He was a 90-mile-an-hour baby from the start, really. He wouldn't go anywhere without a football in his pram or his pushchair. The first day he rode a bike without any stabilisers on, the first thing he wanted to do, he was 4 years old, is to go to the ramps. It wasn't good enough in the garden or on a flat piece of ground. He wanted to go somewhere where there was bumps. You know, he's had the normal sort of bumps and bruises. I didn't want to stop him doing things he wanted to do. I didn't want him to sit in front of a PlayStation or, you know, sit indoors. I never wanted that for him. I tried to protect him as much as I could, but, you know, sometimes you can't. You just can't do it.
He was skateboarding in a sort of big U shape, from what I can understand. And he went up on his skateboard, and then people saw him. Next thing, he was on the ground, and he was face down, and he wasn't moving.
When I walked into the skate park, I could sense that it was very bad. I could see the paramedics who had already got there, and I could see one of them was visibly shaking. And I thought, we're in big trouble here. I wanted to sort of give him a cuddle, but he was in no state. He was sort of screaming out. It was horrific. I then sort of ran round the corner almost and was just completely in shock. I was crying, I was screaming. I felt ill. I didn't know what to do with myself, really. And the next minute I heard them say, the air ambulance is on the way. I went outside and was very sick. Just the worst words you could ever hear is that your child's going to be airlifted somewhere.
Okay, ready, brace, side.
Doctors now need to examine the CT images of Max's brain to determine the level of damage. His parents are still on their way to King's with the police.
That journey usually takes you around 2 hours. I mean, they got us there in about 45 minutes. It was fast, but probably still not fast enough for how quickly I needed to be there.
We were just holding hands in the back of the police car, and I don't think you say a lot. I think we're both thinking the same things. And then we went into A&E, into a family room. That was probably the worst time, sitting in there, not knowing, you know, what they're doing and how serious it really is.
welcome to Kings College Hospital.
Nice to meet you.
86-year-old Terry lives with his daughter. He's been brought into resus after falling down his stairs at home.
We'll look after you, don't you worry, my darling. All right?
Yeah.
Doctors need to check for damage to his neck and spine.
The only pain I got.
Okay, no pain in the neck?
No. I've been trying to get rid of this bloody one for years.
Have you? Well, you've succeeded, darling.
What's that?
He's been trying to get rid of this all over for years.
Ah, well, there you go.
There you go.
We've done you a favour there.
We've sorted it for you, darling.
You might not believe it, but that's true, that.
We're going to try and get you off this cold thing. You ready?
Yeah.
Count of 3 going to 45 degrees. Ready? 1, 2, 3.
Sorry, Terry.
Back on 3. Okay. Ready? 1, 2, 3.
Oh, Terry's... Sorry, mate.
I'm just going to say something.
Go on, say it, Terry. Say it, mate. Say
Try
it.
and shock us.
Go on. What did he say?
Terry, I think that's quite justified, the temperature of that thing, so you not go...
There's another half going.
You
Try and
go.
surprise us again.
Not a day that goes by that I don't hear some form of obscenity or swearing, yeah. If you didn't, it would be so bizarre in an A&E not to hear a little, even just something mumbled under the breath. I think it's always there.
I'll say a few words.
You say a few words, you can say whatever. You're in South East London now, my love. There's no words that we haven't heard before.
Yeah, that's right.
I'll tell you what, the fruitier the better. If they're just using it as an adjective, like about their leg or, their head, I sort of think, yeah, it probably hurts, yep, okay.
Right, so I'm just going to check your neck. Any pain? Does it hurt?
No.
Where I'm touching, does this hurt?
No.
Does this hurt?
Well, a little bit there, a little bit.
Yeah.
It's just, it's nothing really,
I'm going to try it.
Oh, you look even better with all that off now.
Oh, it's been a bit of a day.
Don't get upset, my lovely.
That's all right.
It's all right. We're going to look after you the best way we know, my darling, OK? You'll be all right. All right. You've had a right old time of it, haven't you, getting all the way up here?
I don't think...
Hey?
I don't think I'll make it this time.
Oh, Terry, don't speak like that, my darling.
You're going to be just fine, darling, OK? It's just been a bad night, that's all.
Yeah.
All right? OK, my darling.
I don't think I make it this time.
No, you're going to make it, of course you are. Terry, sweetheart, you've got a bump on the head and you're going to be fine, all right? You're going to be just fine. This will be a good story you can tell people. Yeah, your big trip down to Kings, darling. A lot of the elderly patients I've looked after, they're so stoic, like they're amazing. So a lot of the time they're just very get on with it, go ahead and do it. But then I think at times, particularly I think if they're in fairly good health and they've had an accident, it's almost like it's rocked their confidence. I've had, some of the burliest looking, like almost truck driving, great big sort of 50-year-old grizzly men in Australia that have cried like babies. And, that's a really sad thing to see, when they're just so uncertain and you can just see they're terrified in their face straight away. It's all right, darling. It's all right. And it's quite heartbreaking. You imagine if it was your own granny or grandpa, you'd just want to give them a little hug and, settle them down a bit.
Oh,
sweetie. Oh,
you don't understand, really. Yeah. When I become 14, I put on long trousers.
You became a man. You acted different. You stood back and you let the woman get on the bus first. If you were walking with a girl along the road, you always walked on the outside. That was courtesy.
It's been a long old day.
I've always been like that. Things that go through your mind, you see.
Oh, absolutely.
I don't think I'll make this one.
You're going to make this one, darling. You are. Terry, you've had an absolutely horrible day. You're going to be all right.
Yeah.
Okay.
My wife looked after me like the Queen's looked after, if you like, or the King. I was always a good provider. I always went to bed 10 minutes before, and I slept on her side. And then when she used to get up, I moved over to my cold side, and she got in my warm side. That was one of the things that you do when you're married, you see.
Terry, sweetheart.
Where there's much love for one another. When she passed away, or maybe more love for one another. Yeah, because we spent our life together. She was a lovely woman. I've lost her now.
I'm going to have a good look at that head of yours.
Yeah.
I'm going to send you for a CT and have a look at your brain, all right? See what we can see, shall we?
See it rattling round in there.
Look through me ear hole.
Well, I did, but the light shone the other side. That was the problem, so we thought we'd better go and get a bit more of a good look.
On that side. Okay. Beautiful treatment.
Tell you what, it's easy to look after lovely people. And it's very lovely to have met you, and I'm glad you came here tonight so we can look after you, darling.
Food trolley. Food trolley.
You hungry, JB? You're not hungry?
No.
Oh, okay. Because I don't have no dinner for you anyway, so might as well.
Food trolley.
I'm getting very hungry. Yeah.
You're always hungry. No.
Food trolley.
Hi, sorry about all the delay.
Hector is awaiting the results of his hip X-ray. The severity of the break will determine how soon he'll be able to walk again.
So essentially, the bit that I was telling you about, it looks like that is what's happened on the X-ray. So essentially, the muscle on the front of your leg here inserts into a bone on your pelvis.
Yeah.
And when you have sudden movements like you did,
it pulls it out.
Pulls it off a bit. So on the X-ray, that is the appearance of what's happened as well. But it's only a very, very minor injury there.
Yeah.
And it's likely that it won't need any particular treatment for it, but you will need to have some crutches and sort of partial weight bear for really a few weeks, maybe like 4 to 6 weeks. Okay, of which you'll be off sport. So sorry to be the bringer of bad news.
That's fine.
But yeah, a bit more waiting. The bone doctor will see you and take it from there.
Okay.
Okay, thank you. All right, it's okay.
There you are. 6 weeks on crutches. Should be fun. Get my own muscles.
I can't think of anything worse than you on crutches. Clumsiest boy alive on a pair of crutches. Oh, God. Just never mind, have you brushed your teeth and have you done your inhaler? Have you got your flaming crutches?
I didn't even cry.
It's nothing to be proud of, Sam.
I broke my leg and I didn't even cry. I'm a man. Can I tell Dad?
No, you're an idiot. No.
Let me. Please. Please. I want to bring her families. Hi, Tallulah. I hate to be the bringer of bad news, but I've kind of broke my leg. So I'll be on crutches for 8 weeks. So can you get Dad so I can tell him?
I don't know why you find it so amusing.
Hi, Dad. I've broken my leg. Yeah. Didn't even cry. Summer.
Give me the phone. Give me the phone.
Okay.
Yeah. Hello?
I don't think there's any problem with crying. I remember I used to cry quite a lot at like grazing and stubbing toes and stuff and like stepping on plugs. When you get older, it's more emotional stuff that hurts you than physical. The last time I properly cried was when my grandma passed away, which was about a year and a half ago.
Well, it's sort of like a tear. I think that's the best way of describing it. But they have to...
cry?
Well, we're just waiting for the bone doctor, who's going to come and talk us through the actual details of it.
My children laugh at me because I can't even watch Midsummer Murders without weeping or hiding behind the sofa. I am terrible. I can cry on an advert. It's ridiculous, frankly.
OK. See you later, roast potato. Bye-bye.
Didn't even cry.
You'll cry in a minute and I punch on the nose.
Because I'm a man. Didn't even cry.
I've noticed with Hector as he's growing up and he's sort of changing into a young man, is that he kind of knows himself a bit more now, and he'll, for example, take himself off if he knows that he's going to get into trouble. Just he's taking himself away from a situation.
It's extreme agony.
Well, you will find yourself in agonising positions at some point because
No, I won't cry though. Because
you're an idiot.
So,
who are all those people pinging you?
it's because they love me. They're like...
You're hilarious.
Likes your comment. I was playing football and didn't cry.
Most people cry when they're watching you play football, though.
Yeah, in my brilliance.
Is that what you call it?
Can we go now? We're already itchy bum.
That's excellent news. All round, really. Excellent news.
Okay. Hi, I'm Dominic. I'm one of the nurses. I've been looking after your son since he came in. Come and have a little look. Now, he does have a tube in his throat that's breathing for him, OK? And he has...
Max's parents have been waiting whilst he's stabilised. It's been over 3 hours since they last saw him.
I was terrified to see him. I was scared. I couldn't sort of remember how bad the facial injuries were. I just wanted him to be alive. And that's all they could do, was keep him alive. He was in that bad a condition.
So we're going to get him ready now to go to the... Sorry, you can stay there, it's fine. Yeah, stay there, it's fine. To the surgical critical care unit, OK? And once he's there, we'll get him all settled, and then we're going to wait for the results back so that we can actually know exactly what our plan is going to be.
In the heat of the moment, in the trauma call, when they've just come in, I think we're all too busy concentrating on, keeping the person alive, making them stable so they can go to scan or they can go to the operating theatre. It's not until the relatives arrive afterwards you think, before this patient became a patient, they were a person, and they had a mum and dad, they were having a good time with friends, and then all of a sudden, they've had a life-changing accident, and then nothing will ever be the same again.
Initial results show the start of a life-threatening bleed on Max's brain. He'll be taken to intensive care, where the next 12 hours will determine whether he needs emergency neurosurgery.
When people come in with head injuries, families will always ask you, what's the future look like?
You're stood at the end of the bed and you're going, I can't say for certain. You never know how someone is going to recover and whether or not someone will wake up. And that's one of the hardest parts of the job, the uncertainty that you have to relate to relatives.
Max has multiple fractures to his skull and remains unconscious.
Once we'd first got to critical care, they just said that the next sort of 12 hours were completely critical. On the Tuesday evening, they reduced the drug and said that they wanted him to try and stir and see what would happen. But still by Thursday morning, there was nothing. And we were then again really worried about how much brain damage he had.
You know, he's just lying there and there is nothing you can do. You can talk to him, just give him little cuddles, little kisses, things like that, and just hope that he can hear you and he can feel you, and, you know, just trying to reassure him.
It's been over 3 hours since 86-year-old Terry was brought into resus. His daughter Anna is still waiting for news of his condition.
Let me get you a little bit of water, darling.
Thanks, my love.
That's all right. Should we get you a cup of tea as well?
No, it's all right.
Yeah, you can get you a tea or a coffee if you want one, darling.
Well, I'll have a cup of tea.
Cup of tea?
No sugar.
No sugar, just a bit of milk. I'll get you that, okay? Hello, resus, Sarah speaking. Hi, Hannah.
I'm Sarah. I'm the nurse sort of running this area. We've got Terence here still. He's going quite well. There doesn't look to be anything sort of really nasty or going on with the scan of his head.
May sting a little bit.
Pardon?
May sting a little bit here.
Sing?
Sting.
Sting.
I've got to be honest with you, we've all fallen in love with him a bit. We just think he's adorable, so he's lovely.
You can't get it wet, the glue.
Okay.
Okay?
No problem at all, Anna. Okay, bye.
What do you think, Sarah? That's all right, isn't it?
Beautiful.
We're all fixed up now.
New. Good as new.
Wow.
Even better.
If I was 60 years younger.
Oh, I know, I'd be in trouble.
Well, you only look about 17.
Oh, I liked you before, I love you now.
What would you do if you were 17 there then?
Oh, God. Probably go out and be just as silly as I was the first time.
Yeah, well, see, you're only young once, girl.
That's true, that's true.
You're only young once, true.
I know.
You remember the good times, not the bad times. Right? Although they crop up occasionally, the bad times. But there's nothing you can do about it, is there? If there's something going to happen, it's going to happen. You never know what's going round the corner. I went up the stairs. I didn't know I was bloody well going to fall down, did I?
He's just the cutest, beautiful man, I think.
Imagine if all of the people that came in were like that.
You could just come to work for days, couldn't you?
There's nothing good at old men who laugh and cry and chat and swear.
I know.
Because it makes you giggle. Whereas when, it's funny, isn't it? If a teenager swore like that, you'd be like, oi, oi, oi.
No, but you wouldn't if they were charming, but they're not.
Yeah.
He did it in context. If he was
no,
like...
No, he said, do you mind if I say?
No, but do you know what I mean? If he came in and goes, oh, this fucking hurts, that fucking hurts, even at 86, you'd be like, wind your neck in, mate. Wouldn't you?
No, you're right.
But the fact that he's been so charming...
I'll see you later. I'm going to go home and go to bed. Okay, it was an absolute pleasure looking after you, okay? I can't let go. I love him. Oh. There's a CDU bed for a gorgeous man. I've clicked him there, but I'm not quite ready yet.
You're going to tell your husband about him tonight?
Yeah, I'll be like,
we've had a nice night.
It's been lovely.
Anything could happen now.
Oh.
I can deal with anything right now.
I know.
I'd love to be a mixture between my parents because I think they've both got ups and pros and cons, and I'd like to be friendly and kind, but I think I'd also like to be able to be stern when I need to be stern, and also I think I'd like to have opposing qualities, but you can sort them around when you need to. I don't think I'm quite a man yet. I think I'm still a boy, but I'm developing into one. I might be one shortly.
We slept in the waiting room for 2 nights. It even felt weird just walking outside the hospital for a breath of fresh air or something. We just wanted to stay where he was.
I knew we'd just have to deal with it. We would deal with it. It wouldn't matter. He would have the best life he could have. However he went home, he would come home, and we would have to deal with that.
Are you waking up today? Is today the day? Hey? Is today the day? Good.
There you go. All right, mate.
How are you? How are you? Mum's here.
It was like giving birth again. It was almost that same feeling that, you're so worried that you've lost him and that you don't know what you're going to get from him. But for him just to wake up and recognise Steve and I was the best thing that could have happened.
The first thing I remember is learning to walk again. I remember going out into the ward. I saw my girlfriend Megan, my sister Michaela. When I saw that, I was started crying. I was like, oh my God. The first date I can remember was my girlfriend's birthday. I didn't even know it before.